And aside from that, he was already advised before naman na if the pain gets worse, we will likely need to do a total hip replacement procedure. For Mr. Frenchy, who is over 80 years old, the usual concerns on doing a major surgery sa hip is, am I not too old for this? Kay, again, he was around 80 plus, 87 I think. And then I assured him and his wife na we will definitely see your cardiologist, who's also a friend of mine. In these cases na medyo complicated, patient has a heart problem because with his age, he's had many surgeries before. We definitely work with our fellow internal medicine doctors. If they have a heart problem, we have a cardiologist on board kay for the heart. And we wanted him and his wife to make sure na, of course, we are wanting you to be safe during the procedure. Di taganahan og any unwanted complications. So, we underwent medical clearance with the cardiologist. And for a lot of those who are asking, Doc, pwede ba because I am high blood or my mom is high blood, I have diabetes, can I still have or should we still have these types of surgeries at our age na 80, 90 years old? I always say this to all my patients and their relatives na for me, age is something that yes, we do need to consider, but we also need to consider listening to the patient's goals. If the patient is 80, 90, 100 years old but still is very active, magsige paglakaw-lakaw and wants to stay active, then yes, we need to undergo clearance with a internal medicine doctor. If the patient has high blood pressure, heart problems, we always refer to our friendly cardiologists. If the patient has had a stroke, a brain attack, we refer to the neurologist first and ask permission. Sometimes they delay surgery if there is a new stroke for about 6 months. Sometimes they get cleared. Again, the decision to operate is not sa patient ug sa ako alone as the main surgeon. We always want the safety of the patient first. Number one is the safety. That's why we ask permission from the neuro if na problems sa brain, sa cardio if na problems sa heart. And of course, if you had problems with diabetes before and you're afraid that you will have problems with the wound, we always refer to endo or diabetes na specialists because we want the safety of our patients to come first. And only then do we talk to our patients about proceeding with surgery if they understand that yes, there are risks and these are the risks that are possible. It's what we call informed consent. We need to inform the patient of these risks before the surgery. We also need to make sure that the safety of the patient comes first before any procedure.